Dear friends, heartiest welcome today on the World Mental Health Day, 10th October, celebrated by Anthroposophic Psychology and Research Association, along with Dr. Anand Nadkarni. And here we are, Dr. Sanjay, Ranade, and myself, Suchitra, Inamdar. We are the directors of Apara. We welcome all of you to this wonderful talk with a great stalwart in Indian psychiatry today, Dr. Anand Nadkarni, who's a founder of IPH, Institute of Psychological Health. And of course, his introduction can go on for another 2 hours, but I will want to just restrict myself because I'm sure all of you already know of this towering personality in the field. Our interest as anthroposophic psychologists, as students, teachers, and trainers of anthroposophic psychology has always been in sustainable psychology, which comes from the roots of our own land. And that is exactly what anthroposophy is all about, isn't it? It's about the wisdom of the human being. So, we are today going to have a wonderful discussion on mental health perspectives and practices, East and West convergence. And we will talk with Dr. Anand Nadkarni over here, ask him questions and have a wonderful conversation about his inspiration, about his work into integrating Indian philosophy, the wisdom of our own land with the clinical experience of psychiatry. So, welcome all of you once again, and we start our conversation with Dr. Nadkarni. I'm sure all of you are going to take away a lot of wonderful things from all that he has to share with us today. Hello, Dr. Nadkarni.
Namaskar.
Namaskar. And we are so happy to have you here today on the platform of Apara. And we are so thankful to you to bless us in this wonderful manner, our new work and our kind of quest that we have as anthroposophs into the Indian wisdom. So my first question to you, Dr. Nadkarni, is about what must have inspired you to move towards this convergence of the Indian philosophy or study about the Indian philosophy so much that you have already spoken about it through different YouTube sessions that you've had. And what was your inspiration to actually integrate it so wonderfully with your clinical practice? And when did this start coming in? And when did this whole quest took fire in you?
Yes, it has been a long journey. It has been a journey of almost 23, 24 years with Indian philosophy. But actually, to do all this, that is to go along with the core clinical psychiatry, to add certain facets to that. That is the story because I have been working with people, with society, with community throughout my career. In fact, from my postgraduate career, even when I was not a MD psychiatry. So, as an extension of that, we started in 1990 Institute for Psychological Health in the city of Thane. And our goal, mental health for all, Sudhrud Man Sarvansati. We started working with community. When you start working with society, different levels of community, you realize that it's not only your clinical acumen. Clinical acumen means as a clinical psychiatrist, I diagnose mental illnesses and treat them mostly pharmacologically. And to add to it, I had very good communication skills. So my practice was doing quite all right. But then while working with community, I felt that in addition to this, I must also learn about any kind of structured psychotherapeutic approach. And I was also in my life at that time going through a kind of an emotional crisis. So I started learning rational emotive behavior therapy, REBT. So Professor Kishore Phadke was my first teacher. And then Dr. Shubha Thatte, who is my teacher mentor, along with her. So that introduced me to a Western psychotherapeutic approach. So which was quite in tune with my clinical psychiatry. And then I discovered that REBT has certain parallel points or alignment points with our Eastern philosophy. And the trigger or the inspiration was during corporate training programs for executives, people used to ask me that you are talking about rationality, you are talking about how beliefs and how emotions, they influence the decisions of people. So Bhagavad Gita is telling you the same thing. And then they said that karmanye vadhikaraste means what? That you continue to do your work and don't expect any results and continue. So that tone was very pessimistic. I said, this must not have been the wisdom. So had the tone been so pessimistic, then after listening to 18 adhyayas, Arjun would not have taken up the arms, no? He would have left them there only. So I said, there has to be some gap here. How people are perceiving and what must have been said. So let's go to the source. So that is how I went to Bhagavad Gita and got immediately disillusioned because of the Sanskrit, which I had left, or Sanskrit had left me right at the stage of SSC. So then I said, okay, let's come back to Marathi, my mother tongue. So I opened Gita and I could sense the words but not the meaning. Then I started studying Vinoba and his Gita Pravachane and so many other things. Then finally I landed up with studying some Sanskrit also. But that is how this whole quest started, that how can you align the principles of rational emotive behavior therapy with the ancient wisdom that we have. So it started with Bhagavad Gita, then it got extended essentially to the saints and saint poets of Maharashtra, because that being my mother tongue. And I started using what I was studying with my patients in individual sessions, in groups, and with many communities. For example, when I was taking sessions with corporates, there was a session which I remember at Kirloskar Wadi with Kirloskar engines. And they were workers and all of them were in Marathi. And the entire rational emotive behavior therapy session I took with the help of Jnaneshwar and Tukaram. And they could understand, and not only understand, they could resonate. And then I felt that, look, this is something that goes and resonates with people. And although I have a class of people who do not know anything about this, but there is a class of people who have references from this ancient wisdom. And then I also realized that people are getting interested into this. So then I have to also give them the try to give them the correct perspective. So then from saints, poet saints of Maharashtra, I slowly went to Vedanta. I started learning about Vedanta and Upanishads also. Then I got teachers, Nima and Surya are their names. So I started learning Vedanta from them. Then I started learning the Buddhist thought, both the Theravada and the Mahayana thought. So that is how my whole journey into Eastern philosophy started.
So amazing.
So that has been the association. And then how to integrate it in my day-to-day practice. And since I have a habit of writing, whatever I practice, I write also. So that is how my books also came. So this is the journey.
So in these, while working like this, what did you find are the characteristic differences between our understanding of mental health and the Euro-American or the Eurocentric models or thought on mental health?
Yes. Actually in West, what happened was that post-Renaissance, the Cartesian thought, as it is called, it gave rise to a thinking in medical sciences which is called as biomedical model, where actually study of mind was put aside from the medical field. And the focus was only on body and the physical aspects of it. And from that time, the mental health or the mental illnesses were quote unquote treated by segregation, by asylum. So there was this great doctor called Pinnell who for the first time unchained the mentally ill people. So their entire focus was that psychiatry or psychology is not a part of medical science, and whatever treatment is to be given by segregation. Now, this continued in the Western society till the advent of Freud on one side in Europe, and at around the same time the behavioristic school that was there in the Russian part of the world. So Freud was essentially again a clinician. So he had patients in front of him. So the entire focus of Western mental health approach has started with illness. It has started with disorders, and therefore finding out the root cause of disorders. The entire Freudian psychology focuses on disorders, right? Because that is how it developed. In fact, you agree with me that positive psychology as a part of psychology and mental health movement has been adopted by the West very recently.
Very easy.
So that has been an important aspect. Second point is that the psychopharmacology is not even 100 years old. All the therapies of West are around 100 years old. So in a way, this is one of the youngest disciplines, mental health, that means either psychiatry or psychology, for the people of West. Now in that comparison, let us look at the East. So for the Eastern thought, psychology is taken as an extension on your path to go towards your higher self. So self-discovery. And you want to actually emancipate yourself, develop yourself further, actualize yourself further, to borrow from the West these words. So that is how West, that is how East looks at it. That I want to put myself on a higher plane, Adhi Atman. That is what Adhyatma is, to go towards a higher plane. So that is where the East looks at normal developing into better as the very essence of psychology. And the East looks at mental illnesses as an aberration. East believes that all people in core are not only good, but they have divinity inside them. So that is something very positive way, that look, the conflicts come later, but you have a possibility of divine. Not only that, but Vedanta says that you are divine.
In anthroposophy, like we say, there is no point in studying darkness, because darkness is basically the absence of light. So you study light, you don't study darkness. And that's exactly the model that we apply even to mental health. That you study health.
What happened
and the deviation. And it's exactly what you said.
What happened was that the mental illnesses were treated as aberration, and they were treated along with the physical illnesses.
Yeah.
So in Ayurveda, if you see, Prakriti iti shariram, Prakriti iti swabhavam. So swabhava and sharir went along with, together. Also they had a kind of preventive approach. So it was swasthanam swasthya rakshanam vyadhitanam parimokshanam cha. So it was the swasthanam swasthya rakshanam, because that was the part of development, and then vyadhitanam parimokshanam cha, that is treatment. So you had all that, right? And very importantly, the culture was of assimilation, not segregation. Most of the people who were, say, chronic mentally ill of those times, or what we call today as Divyanga with deformities, were assimilated in the social mainstream. They were never segregated, correct? So there are so many references where people who did not have any kind of support, the whole village used to support those people. There were ladies who would weave clothes for them. There will be people who will be giving them regular feeding. So all these people were assimilated. So our culture is of assimilation, has been of assimilation, not of segregation. So I think that is also a very important point. But as a result of that, what happened was that mental health, psychology, psychiatry did not develop as a independent discipline in our country. So if you see Indian psychology, then we will have to go to Patanjali, where his Ashtanga Yoga Darshan is actually a practical part of the Vedanta Advaita Tattvajnana. So as it is put that Advaita Tattvajnana is a philosophy, and if you want to practice it, then you can go to Ashtanga Yoga and learn it. So similarly in Buddhist thought also, in fact Buddhist thought is more a kind of a cognitive based thought. So it goes very well in tandem with what we call as CBT or REBT today. But they also thought about emancipation and actualization, for which they advocated different meditative practices.
So you're saying that philosophy takes that REBT, CBT thought even ahead.
Yes,
takes
it does.
Yeah.
It does.
That's amazing.
So,
Yeah.
actually, see, this could be debatable with staunch believers of either thought.
Of course.
But see, what happens is Gautam Buddha's thought starts at the cortical level, all right, but he always talks about nirvana minus the Brahman of Vedanta. So, as it is said, Vinoba has said it very nicely that, and even our scriptures, that ya pashyati sa pashyati. So, on one side you will talk about nirvana, which is the loss, I mean abhav, and on the other side you will talk about purnatva. So shunyatva and purnatva. So shunyatva is one way of looking at it and purnatva is the other way of looking at it. What is very important in Eastern thought, it could be Vedanta thought or it could be Theravada, or Mahayana further is a bridge, I feel, after studying between Theravada and Vedanta on this side. So what is very important in this is actualization, emancipation. You can really find your wise self within self. So that kind of a thought was there, but formidable psychopharmacology was not there. So the modern sciences gave us formidable psychopharmacology to treat mental illnesses. They gave us research formed and tested psychotherapies. They were very good in documentation. They were very good in giving us material, copious writings, and all that actually helped us to, in a way, build the modern way of learning psychology. So that is why there are plus minuses are on the both sides, and therefore our approach that how to integrate both the things.
So if I'm getting it right, are you also trying to say that our mental health, our own discovery of our own sustainable mental health in India probably paused at a level simply because we couldn't create science individually out of it away from philosophy? Is that what you're saying?
In a way, yes. And at the same time, whatever was the modern scientific thought, that was given to us by rulers.
Oh yes, of course, yeah.
Correct. So, and we saw that the physical health system that the rulers gave us, the British, it was working. But for them also, mental health was not a priority. And similarly, after independence, we were so bogged down with great problems of physical health. It was, it was impossible to give that much of weightage to mental health. And we always thought that our family system is good, our cultural strengths are very important. We, in a way, we went into a slight denial.
Yes, absolutely.
And that is what I feel, and I think it was globalization that shook us out of that denial first. That look, you may have been traditionally like this, but now the world has come to your doorsteps. And again we were shaken up by Corona, very, very recently.
Because traditions to stay alive, I'm sure they require a rediscovering constantly. And probably that rediscovering is now happening. In the last few, at least in one decade, I can see a great surge of that kind of
Yes, and that is why what we are discussing is very timely, I feel.
Absolutely. And I'm sure like our whole audience will love to and get inspired by, what you're telling us, because it just joins the dots so well, of all the questions that we have and fight between, whether we should just apply Western therapies, just take them and just get them here or no, and I think you're putting it so beautifully on both ends, like why what are the assets of
Both the systems.
both systems. Absolutely. Yeah.
What could be the historical reasons for these differences to emerge over the span of time?
As I said, that historically, modern mental health was given to our country as that model of segregation, disease oriented, and you have to reduce symptoms. So, reduce symptoms by using essentially pharmacological means. And that is what the model said. Even during that time, people like Dr. Vidyasagar in pre-independent India times also tried to kind of revolutionize this kind of a model. Dr. Sharda Menon in Madras, that time Chennai now, also did wonderful work in kind of breaking that system open to people. But we borrowed that system. Now, I think it was very good that the policy makers thought of converting the mental asylums into teaching institutes. So, the institute Nimhans at Bangalore or at Ranchi are good examples how this was done. But it could have been done with more rigor. But again, for policymakers, mental health did not have that much of a priority. But post globalization, what happened was that people started feeling that distress part, that segment of distress which was not very apparent in the society. If you look at last 30 years after globalization, you will see that between disorder and development, a segment of distress has come up.
Yes, that's very true.
Distress means that I don't know how to face this year. Now this is the demands by my corporate boss, demands in relationships, my own aspirations and gap between my aspirations and my efforts, how to face this. Competition, consumerism, these things are now carving out one more segment, that is distress in mental health. And what happens is that people like us, clinical psychiatrists, we are trained in dealing with disorders, not with distress, and also not with development. So what is very important for us to understand that this is where the East can help. I mean, one of the ways that in distress and development, if we can come together, the Western counseling and psychological methods and the Eastern wisdom, if we can really get them together and have a studied confluence, not confluence by chance, but a studied confluence, that why am I doing this?
That is rooted in scientific inquiry.
Rooted in scientific inquiry, then we can actually go beyond what has happened in history. Another point in history is that in the voluntary sector of public health also, people had to focus on physical health. And therefore what happened was that historically mental health, even in voluntary sector, did not get the kind of importance that it should have got. There are certain nice examples. One example in Maharashtra is in Gadchiroli, Search organization started by Dr. Abhay Bang and Dr. Rani Bang. Very early in their own career, they focused on de-addiction, which was a psychosocial kind of a problem. And they tried to work out the psychosocial aspects with the physical health aspects. And they also ventured and are running successfully a mental health OPD for the local tribal area also. So they had that kind of a vision that from physical health, we have to go towards psychological health and larger social health. But those examples are few. So that was one more reason historically that happened, that in voluntary field also, agencies and people where their thought was dominated by the physical health aspect. And as far as mental health professionals are concerned, historically, not only their number is less, their number is definitely less of psychiatrists and psychologists, but psychiatrists, they started feeling, and many of them still feel, that clinical model is enough. Why should we go and work with the community? Why should we go and do therapy work? We can give medication. So that was one aspect, and I think the mental health professionals need to be more enterprising in days to come. Enterprising not to only earn money, but enterprising to expand their vision and to go beyond the clinic setting or a clinical setting and be innovative in their approaches of reaching out towards the community. Secondly, the team building part in mental health professionals historically has not been very strong.
Yeah.
So people have been functioning as islands and they have been doing well, but they are functioning as islands. So one of the aspects is that mental health in our country has not been able to make a cultural and a social impact
Absolutely.
the way it could have done. And one reason is that we have not been able to take aside our so-called Western makeup and Western get-up. We have not really become Indian.
Yeah.
So that is the reason why even today people would prefer to go to a traditional healer and people would prefer to go to a spiritual entrepreneur. I use that word with utmost respect. So, so they continue to go there, but they would get stigmatized to come to a mental health professional, whether it is a psychologist or a psychiatrist. No, we have to look inwards as professionals and think why it is happening. It is happening because we have never gone and felt their pulse. We have not gone and felt the pulse of multitudes of people who still have their cultural, traditional connections very live. Right? And I think the modern psychiatry and psychology still has a kind of a metropolitan thinking.
Yes.
And it's the old thing.
I agree with you because just a few minutes back when you were talking about us as Indians as a very collectivist society, in fact with so many years of advent of psychology in our land now, we should have discovered, which we haven't unfortunately, the whole advantage of this collectivistic approach where we could have made a beautiful community of mental health. As a therapist, I feel probably as a collection of professionals, maybe even, I'm much younger in the generation, but even in our generation, I can see that it's just about professional work. It's not a vision of mental health.
That's right. Very true. What is happening is that as far as psychologists are concerned, there is a unevenness in the way they are taught or the way they are trained.
Yeah.
So that is there. Another point is that psychologists do not look at their career with a vision, but they only look at it only as a profession.
Exactly.
Second point, and the third point which is very important is that why is psychology today taken as a part of the arts discipline? I don't know. So I think that is something that in our society arts means girls.
Yeah, absolutely.
Somehow,
Yeah.
all those irrational beliefs are there. And then why should psychology be a part of arts? No, it should be a part of science.
Yes.
So everywhere in our system you will see that psychology has become part of arts.
Exactly.
So all these I think are historical reasons why we are not seeing mental health in its own perspective. And what is my concern, I'll share with you, that post-corona times there is going to be a kind of a upsurge in the people's mind because of the circumstances to take help from mental health professionals.
Yes.
And if the community finds the mental health professionals woefully inadequate
Yes, inequipped.
and inequipped to deal with the demands, then there is going to be a backlash. So I think we as mental health professionals need to introspect and weave our own networks of mental health professionals, psychologists, psychiatrists, counselors, rehabilitation therapists, occupational therapists, everybody along with community. along with people who are interested in mental health. In addition to the students of psychology, in last 10-15 years this is happening, that there are a lot of people who are interested in mental health are now getting trained in mental health. They are doing their psychology post graduations. And I feel that this is going to be a very important group for future community work.
Yes.
Because these are the people who are interested. These are the people who are not interested as a profession.
Yeah.
These are the people who want to give as a service to society.
Yeah.
And I think that the trained psychologist can do profession. Doing profession is not bad.
Yeah.
But then these people, this group will contribute to the community work in more and more numbers in the future. And there I see a hope.
Yes.
Doctor, what would be the points where these two approaches could converge? What could be those specific points? And could you also say, for instance, what could be the 3 areas where we could work on it together?
Convergence will come out of a common concern. And I think East and West have a common concern, and that we can call as destigmatization. That today we want to destigmatize mental health. And that has been the point of view of the East also and West also. And second point is development. That even the Eastern part always thought of psychology as a means of development, and the Western theories and therapies are now also coming to that. So I think destigmatization and development can be the points of convergence. But we will have to have practical models of this convergence.
Yeah.
And they will have to be both theoretically robust and practically implementable. To give you an example, that suppose there is yoga as a part, yoga upachar as a part of our ancient wisdom. And there is yoga therapy. So how we can integrate the modern psychology principles into that yoga therapy? That is one way of looking at it, convergence practically. So you have definitions given by the yoga Ashtanga Yoga of mind. You have different models given by modern psychology. Understand both. So capacity building of yoga therapists, yoga teachers can be a practical model of convergence. There we will have to see to it that the yoga therapy also retains its Eastern ethos and does not become only a tool of fitness, right? And secondly, we'll have to see that in the capacity building of the yoga teachers, how can we intricately weave counseling approaches? See what happens whenever a person or a family, they approach yoga teacher, their stigma does not operate.
Absolutely.
So they go for that. Now if the yoga teacher is empowered with the mental health aspects from the modern psychology, and also that person keeps the philosophical ethos of the Eastern tradition, then they can be a very important asset to the mental health delivery chain. So now we have to think about mental health delivery chains for convergence. So where all these people can also be of help to us, and the convergence can come, convergence can come automatically, but it will not come automatically, it will have to be worked out. Which means that the professionals who are working in all these fields will have to continuously work, update, study themselves. Then only we can find the integrated approaches. Now, as you said, two or three significant areas. One area that comes to my mind is all distress management. So in all distress management, where people are facing their day-to-day problems, suppose they come for a therapy and say the psychologist with modern learning start say CBT, REBT, TA, whatever school that he or she follows. But keeping awareness of the eastern part, keeping awareness of the development, keeping awareness of how the East also looks at it. And using those inputs to actually work on the therapist's empathic capacity also.
Yes. And the therapist's inner work.
And the therapist's inner work, because I think you will agree with me that when you start studying the traditional approaches, your empathy as a person also shows a kind of a qualitative change.
Yes, yes, of course.
Which I have observed personally with myself also, that the client-centered therapy, as it is said, which focuses on empathy, right? And many people learn the client-centered approach. Whenever you put these inputs of Vedanta or of even the Mahayana thought into these approaches, your level of empathy qualitatively changes, right? And that is where I think that kind of a integration, if it comes in all distress management, it could be of help. It can also help for adolescents, youth, wherever you are talking about personality development. And you are working, suppose, developmentally with different small groups of teenagers, youth. I have been working with artists, I have been working with players, where I try to integrate both these things. Because generally in players, what happens? They are taught meditative methods on one side. And they are not customized. So the players, the athletes, they do that only as an exercise. What I try to do with my athletes is take the cognitive, emotive aspect from CBT, RBT side, take the focus and quality of consciousness from the Vedanta side, and try to merge both the things. So I am using very preliminary concepts from RBT, such as how to be aware of your self-talk, how to get to your belief, how to change to your belief. I am using from CBT, say, affirmations. And at the same time, I am giving them a kind of an insight into their own process of running, of swimming, of jumping, which goes into a kind of a process, what we call in Vedanta as from karma to akarma. So what is karma and what is akarma? In akarma, you are doing your karma, but you are not there. So slowly when you go to that kind of a process involvement, the athlete, then the athlete is gaining. The athlete in a way is meditating. But the athlete is now not meditating because there is a period of meditation.
The meditative state.
He goes into a meditative state. So these are the kind of models that we are trying to work out in our own way with athletes, with artists. And I think that way with all young people and adolescents, it could be of help. The third important application, I feel, there are many, but with entrepreneurs. The leadership, the entrepreneurship, where we can work with them with the kind of view that we have from the Eastern side. For example, the very word udyog or udyojaga, so ud means up and yoga is integration. So every udyojak is actually working for a higher integration. So in the very word udyoga, it is ud and yoga. So which many entrepreneurs don't know, right? And if you want to be a udyojak, then what you are going to do is you are going to lift yourself up and you are going to lift others with you, and you are going to create wealth, not only money. So these are the kind of perspectives, and on the wisdom of our scriptures, person like Gandhiji, for entrepreneurs, built this area, built this entire theory of being a Vishwastha of your created wealth, which means that we have got these kind of links, People like, say, Gandhiji, people like Lokmanya Tilak, people like Vivekananda, they have tried to actually build all the wisdom that we have in our scriptures towards a kind of a national resurgence. And that's why we call all of them as visionaries, correct? And I think time to revisit that part and how we can use this wisdom that has been created by our own forefathers. I mean, modern forefathers of modern India, and use that for these kind of integration. So that is the kind of view that we'll have to do, and we'll have to also think about, I think, some traps also. Whenever you are using ancient wisdom, philosophies, the religious dogmas can come in any time.
True.
Very true. Yeah.
So we need to differentiate into the Upasana Dharma and the Mano Dharma part of it.
Right.
So the Upasana Dharma can be different, but the common point is going to be the Mano Dharma, the humanistic part of it. And whatever is the humanistic ethos from all these traditions, and wherever we can merge it with science, the modern science, and have models of useful models that will give results. Because, suppose I am working with players, then the players are looking for outcome, right? They are not at that level where they don't want outcome. So we will have to be realistic also while merging these kind of approaches. And when the society gets these messages that, look, this is happening and this person is achieving, say an athlete is winning medals, but after winning medals also, this athlete is behaving very properly. He is not taking success to his head. That is where the training comes. That is where your development comes. So when people will start seeing these kind of practical results, they will start believing that what you are doing, that integration is giving fruits. So on one side, we will have to show the practicality of what we are doing. And I think on the second side, we will have to also work with academics and work on research models, the pre and post, the documentation part, all that we will have to do, so that the body of knowledge also starts rising up based on the process of integrating the East and the West.
We are told, in fact, in a lot of ways, that academically and pedagogically also, we need to look at our own world and try to theorize. In a way, we are talking of deprofessionalizing all of this, so that the last man is knowledgeable about this. Or we are talking of decolonizing, so that we are not stuck in a particular thought process and we are theorizing on ourselves. So, how do you see that happening? How can colleges, universities, teachers, researchers and practitioners, how do you see them looking, academically and theoretically and pedagogically, how do you see this coming together?
For that, in our entire academic system, we'll have to come to a very interesting dichotomy, that in most of the disciplines in our educational system, the people who teach do not practice, and the people who practice do not teach. Now, I think we will have to take out education out of educational institutes. So, Ivan Illich said that many years back. So, we have to kind of take out education out of many systems and make education a very important common domain.
Yes.
And then let people learn, let people be wise. So that kind of a thing will have to be done on one side, but giving the educational system its due, we will have to also work within the educational system. And how we can have the kind of open-centric collaborations. See, we talk about multidisciplinary approach. We talk about it. But when you really start working in an interdisciplinary way, our so-called egos come inside,
Sometimes, doctor, I have also noticed, like while doing our training courses also in anthroposophy, that there is certain kind of resistance which is met from the other end. Even like me being a psychotherapist, I'm training other psychotherapists. So sometimes there is also a little bit of a resistance coming from the other end to learn something as basic. I mean, I'm saying it's basic, but I'm sure it's tough for them to learn, and that's why there's a resistance. Uh, Resistance towards learning embryology, learning organs, learning about the human system, learning anatomy, and we feel as anthroposophists that because it's a convergence again of the body, soul, and spirit, that even if you're working with the emotions, you need to know everything about the body so you know what you're working with. And I'm sure that is what, in a way, you are talking about. And I would like to know from you, like, what could be the method of breaking this resistance?
At a very primary level, the educational system that is there with Western ethos in a way is reductionistic. Now West has realized it, and West from reductionistic now is going towards holistic, and there are many islands in our country who are still working in a reductionistic way. So I think that is what needs to be done, that from reductionistic to holistic. Now whenever the system is going to change, we don't know. But practically, it is very important that different professionals in the field of mental health, they only start sharing, their own wisdom with their colleagues. So for example, very practically, that psychologists should know about psychopharmacology.
Absolutely.
And psychiatrists should know about psychological assessment that the clinical psychologists are doing.
Absolutely.
Right? And both these factors are actually empowering each other. But what I have seen is that many times people do not want to expand their horizons. So psychologists are saying, वो psychiatrist अपना काम कर रहे हैं ना दवा देने का, वो मेरे काम नहीं है. And psychiatrists are saying that psychologists are doing the assessment ना, वो finally I'll see what is written in conclusion. So psychiatrist will take a look at the report of the psychologist as if he is seeing the MRI report. that only last 4 sentences you read and then take it from there. But what is very important
one of my students asked me once, तुम्ही कशाला वाचता ते pathology report? काय तुम्हाला कळतं? मी म्हटलं मला कळतं. तुला पण सांगते आता काय कळतंय.
See, the point is that even psychologists' reports interpreted by psychiatrists, that is a very important point. At our institute, many times what I do is, although the psychologist has interpreted the report for the client, I also do my round of interpretation with the client.
Wow.
So which means that how to read all those reports over a period of time, I have got my own insights into it, which I share with the students who are sitting.
And that's such a huge learning. That's such a
and it's a very huge learning, and you can actually see what you are doing is, you are not only catering to the need of that person who has come with a come for psychological assessment, but you are in a way mentoring that person into your science, which is a very important point. Many times when I do the test discussion with, many times I do it with couples, their compatibility and what the psychological assessment says. And I have never met them. Many times I meet them for the first time with the assessment. And when I start naming the challenges and what is their personality profile and how they are, there have been comments when people tell me that, have you been to our house? Have you seen us fighting? So I said, no, but I can imagine.
Exactly.
So then they say, oh, these are only numbers on the scales. I said, okay, but I am learning to see through these numbers and towards the kind of things that that you are, So this can happen. And when this happens, people are getting the credibility of our science. So it's not a personal triumph, for me. What I'm doing with every communication is establishing the credibility of my science. So I think that is something now with which, if you are inspired as a professional, then you can work for destigmatization.
What you just said was so humbling. I mean, that's absolutely, it's
very
absolutely
basic. There is a very interesting philosophy which says that the client or a of course we call them patient or whatever, they are not only supposed to go out cured, they are supposed to be go out better educated about their state.
Yes. Yes.
Then the chances are they will not come back. Otherwise, if you don't take that extra mile of effort where you educate them about how did you come here to this point and how do you ensure that you don't come back to this point and move up from here, that is something which I found a very strong emphasis in our side of thinking and treatment, which I am beginning to see that the Euro-Americans have learned. And they are beginning to transform their thinking into that. So, which is what is my next question, that I see a very important need to do empirical studies in our world, because we have, one is the sheer heterogeneity of the sample.
Yeah.
Purely in research terms, it is such a heterogeneous sample the world would envy. One is not like the other, so such fantastic diversity, and I think we can add to this whole thing in a much better way. Would you suggest some areas of research which empirically we need to start collecting data? Do you see any specific areas of research where we could start collecting data, or maybe do some theoretical studies or building theories of our own, or exploring? Do you see any such areas?
See, what will have to happen will be, increased communication between different disciplines.
Right.
Unless that happens, the research studies will not come. The research studies don't fall out of the sky.
Right.
There has to be a constant give and take between disciplines. Some 4-5 years back, I was called by the Pali department of Pune University. And it was a very nice experience for me. I talked about the Theravada and Aribiti.
Oh.
And I talked about it for almost 3 hours. And I was glad to see that all those scholars, students, everybody was sitting there. They were listening, they were interested. Even the Vice Chancellor of Pune University attended that course. Now it was very nice to see that kind of a give and take. Otherwise, who would call a psychiatrist in Pali department? Nobody would, correct? So I think that communication at that level, and which means that professionals from that particular domain, start exploring into whatever are the sister sciences of their domain. For example, mental health is my domain. So I kind of ventured into philosophy or Vedanta and all those things, right? So it became my kind of sister discipline, right? So then what are the sister disciplines? Now I feel that in mental health, we can go for many sister disciplines. There is no dearth of sisters and brothers, whatever. So, personally I feel the way I am interested in this part, I am also interested in history, so I always collate history and mental health. Because whenever I start, say, looking at Naneshwar, or looking at Vivekananda, or looking at Gandhiji, or looking at Lokmanya Tilak, I feel that I should know those people while I am reading what they have written. And that makes it very fascinating. So for me, history becomes a sister science of mental health. For me, management becomes a sister science of mental health. So more and more you go into sister sciences. Similarly, a management guy, coming into mental health. So I think that kind of a abhisarana, that kind of a give and take is a preliminary thing for these kind of research materials to come. Then those research materials can come out of, say, PhD studies or MPhil studies, or it could be a kind of a therapeutic kind of a trial where you have a module of CBT and CBT REBT module along with principles of Bhagavad Gita, and you have a module and you practice that, do pre and post, then that will come. But what is required therefore is a merging of theoretical knowledge and practical implication, And as there is an academic angle, therefore, the second part could be the community angle. How are we going to make training materials for people, the audio visuals for people, where people will get a taste of both the things. Both the things means the Eastern as well as the Western part of it. So if we can have that kind of a material in terms of films, audio visuals, we at IPH, we are trying to do that through our channel for all these years, through books. Now we are coming out with a lot of audio books. So all these things will have to be done. So on one side, it is community work. On the other side, it is the academic research. And it is again the convergence of both that will be very, very important for future.
So, Dr. Nadkarni, as we come to the end of our discussion, one interesting, very intriguing question as a professional, I feel that I would like to know your journey into this whole advent of integrating Indian philosophy, and how do you feel you have changed, evolved, emerged as a different kind of a professional, as a human being, because of all these studies which you have integrated with your clinical practice. It would be, I think, very inspiring for various professionals who are hearing today. And of course, it is something that I would like to know myself as well.
What is very important as a professional or in my OPD while dealing with my clients is I can relate to the cultural context in a much easier way now. And also, I can give them examples from their own lives, especially when I deal with people from rural background, or whenever I see somebody wearing a mal, his Warkari say, then I know that how to talk with that family and what are the things that I can give them back. As a part of my behavior therapy, I know what are the exact stanzas from say Haripat that will tell them about behavioral correction. So that helps me. These kind of references, they help me not only in interaction, but to be with that person. For example, I have used Hanuman Chalisa as a part of psychotherapy material, giving them insights about what Hanuman is, what is his personality, what are the things that we can gain from Hanuman, giving an entirely new cognitive perspective to something that these people were only rattling. So I think that way it helps you. Secondly, it helps you to integrate all your cortical kind of smartness, that REBT, CBT, all these branches, they get you at a level of cortical emotions and cortical cognitions. And this philosophical part, it takes you towards the neocortical, more evolved emotions. And if you merge those evolved emotions, as a part of your own discovery, as a part of your own advancement as a human being, then it does change you. Because at the level of cortex, you are already intelligent, smart and all that. But it has a meaning of a selfness that I am smart, I am intelligent. And I think what our tradition tells us is twofold. Our tradition tells us to dissolve me, dissolve the me-ness or dissolve the selfness. And at the same time, our tradition talks about expanding self. And in a way, our tradition says that dissolving your lower self is equal to expanding your higher self.
So well said.
That is the gist of what our Eastern wisdom is. And when you start realizing it in your day-to-day, it helps you to get in tune with your clients, all right. It also helps you as a human being to look at your own self and to look at even the human interactions around you. And I suppose it starts making you more thoughtfully tolerant than your previous self. And that is what the word Sahishnuta means, that it is a thoughtful tolerance. So it also helps you to be a little more innovative, because for you every day is new, all your interactions are new, and you are really helping that person. And whenever you are helping that person without minimum of expectations, that is what the Eastern tradition tells us, then in a way you are becoming a better emotionally managed person. And finally, our tradition says that all becoming is anitya. All becoming is anitya, is Buddha's word. All becoming is maya. Maya is Vedanta word. So what is very important is parivartaniya, ever changing. So all your becoming is ever changing. So once you realize that in your day-to-day life, you start going towards what our tradition says, the being part of it. So from becoming to being is a journey, a individual quest and also a professional quest. And then our tradition tells us that be in your quest and do not look at the outcome. So that is the beauty of it, that you start enjoying the process every day, every minute. And what the Buddhist thought says, that what is very popular nowadays is mindfulness. So that mindfulness means that with your knowledge, with your emotions, with your action, being in that particular moment, being in that particular flow. So the Devanagari that I call for mindfulness is called Kshanastha. So that Kshanastha part is, I think, a very important discovery for me as a person. And
Can it be translated like existing in the moment?
Mindfulness, I call it Kshanastha. So you are Kshanastha. Stha means sthita, sthapit. So what is swastha? Swastha is healthy. So swasthita, you are comfortable with yourself. So Kshanastha. And very interestingly, mindfulness is actually, according to Buddhist thought, you go beyond the cognition. And when your mind gets emptied with cognition, then it gets filled. So your empty mind is your mind full of. It's a full mind. Empty mind is so, which is actually what is the ethos of all our Eastern philosophies, that they respect cognition, but they say that there is a quality of consciousness that lies beyond cognition. And they say that you expand your cognition, and when you go on expanding your cognition, then there will come a point, there will come a moment when you will just touch that consciousness which lies beyond cognition. And our wisdom says that once you get that touch, then your worldly life will always be a changed life. So I think that is the wisdom that our forefathers are trying to give us across the ages.
Right. Absolutely. So, as we come to the end of this wonderful interview, I'm sure all our viewers are going to gain a lot, and I thank you so much for being a part of our little project on mental health. Thank you everyone for viewing, and if you have any kind of questions, anything that you will like to ask as a part of your whole listening of this program, please reach out to us. You could also reach out to Dr. Nadkarni directly or to IPH, and we will love to bridge that gap between you and him. So thank you so much. Namaskar. Thank you for watching this, and thank you for participating. Thank you, Dr. Nadkarni.
Thank you.